Just want a reminder that those of you who have questions, please sign your card so we can get them in and have questions later. Our last candidate is Regina Bateson.
All right, thank you so much for coming out this afternoon. My name is Regina Bateson, and I grew up right here in our community. You know, whenever I'm talking to groups here in the 4th District, I'll be honest, I always start my talks that way. Some of you may have seen me do it before. But in this case, we're really in my neighborhood. My parents live just a stone's throw away from here, and I literally grew up right around here. But after growing up here, I've been able to go off and do some important things for our country, and that was because of the investments that our community made in me. You know, growing up here, I learned the value of hard work. I learned the importance and the power of public education. And I was able to go off after high school, go to Stanford University, later become one of the youngest diplomats serving our country after 9/11, work in DC and Latin America on border security and other important threats to our national security. Then I went back to school. I got a PhD and I was teaching at the university level, training our next generation of leaders. When I realized something had to be done about Tom McClintock. You know, the 2016 election happened and I looked at my kids. And I thought about the world they're going to be growing up in. And I said, this is unacceptable. You know, I can't have them growing up with bullying as their model of leadership. And then I thought, what is the biggest, highest impact thing that I can do to make a difference in our political culture and for the people of our community? And I came back to Tom McClintock. You know, it was just about a year ago that I was at a different town hall. It was Tom McClintock's town hall at Del Oro High School. And that was what pushed me over the edge to run for Congress, to be the first person to step up and run against him. I started with a little website that went viral in our district, and it is because of the overwhelming support of our community that I'm proud to be running a strong campaign to unseat McClintock today. Because I know that we deserve better. We need good paying jobs, we need investments in public education, we need health care that people can actually afford, and we need for our seniors to be able to retire with dignity. Because if we really value hard work, that means that we should respect your hard work and the payments and the planning that you have made throughout your lives. So I'm really happy to be here with you today discussing this important issue. You know, my grandfather actually spent the very last months of his life at one of the apartment complexes right across the street over here. So this really hits home for me when I'm here with you today. And I want to be really straightforward and transparent with you. Maybe this isn't the most stylistically fancy thing to do, but I'm actually just going to run through your questions and give you some clear answers. So let's get started over here. Actually, I lied. I'm going to start with something that's not in your questions, and I was a little surprised. I want to start by saying a few things explicitly about Medicaid, which isn't mentioned in the scorecard here, but is so critical for the well-being of our seniors here in our community. You know, in Placer County alone, there are about 4,000 seniors relying on Medicaid to pay for their nursing home care, to pay for their long-term care. And this is one of the most serious threats to the well-being of our community. Last year alone, Tom McClintock voted for over $800 billion of cuts to Medicaid. You know, there are proposals out there to convert Medicaid into a block grant to states, to limit benefits, so they would just run out at some point. What happens then to that person who is in that nursing home, who has nowhere else to turn? I have never heard a good answer to that question. So I want to make it very clear that I would oppose those measures, and I'll be a strong advocate for Medicaid, and I understand how that relates to Medicare and is an important safety net for our seniors. But to get back to the questions. All right, so we need to start by talking about Social Security, how we're going to strengthen it and protect it for future generations. I do support legislation that would increase grant levels and update the COLA formula, the formula for cost of living adjustments. You know, I do disagree slightly with Jessica here. I've never seen a realistic proposal to link COLAs to localized changes in inflation. What I have seen, though, are some important proposals out there to make sure that the cost of living adjustments for Social Security reflect inflation for seniors, rather than inflation in the country as a whole. Because we know that seniors spend more of their income on health care as opposed to the general population. And where are prices rising the fastest? Healthcare and prescription drugs, as has been rightly pointed out by others here on this panel. So I do think that it makes a lot of sense to take a look at least two proposals that are out there to use a cost of living adjustment formula that's targeted to seniors. It uses a different consumer price index targeted to the elderly. All right, do I support legislation that would eliminate the cap on taxable income? Yes. I think a cap should be eliminated. I mean, this is an area where there seems to be some bipartisan consensus here on the stage. But Mitchell is exactly right that the tax right now is regressive. The cap is at about $127,000. It's going up by a meager $1,000 in the next year. That's wrong. Those who are very high earners should be paying their fair share into the system. And by eliminating the cap, that would solve about 90% of the projected shortfall going forward into future decades for Social Security. I think this makes sense, and it's absolutely something that we should do that's realistic. Somebody who makes $1 million a year, for example, already stopped paying their payroll taxes for this year, back in February. Some people call it Millionaire's Valentine's Day when that comes along. The rest of us, though, that are working hard, pay the whole year. That's not fair, and it needs to change. All right, now when we're talking about strengthening SSDI, it's really important to note that this is a program where attempts have been made in drastic ways before to change benefits. Let's think about the Reagan era, if any of us are willing to put up with the headache of traveling back to that time. McClintock often harkens back to the Reagan era as the model for his solutions he'd like to see in our country. But when the Social Security Disability Insurance Program was radically reformed back in the 1980s, here's what happened. People were thrown off of it abruptly, en masse. It was a humanitarian crisis in our country. There were reports of suicides because there was such drastic and heartless reform. And it took people years to get their benefits back, sometimes even in the most qualified of cases. So I think we need to be very careful and observe the maxim, first do no harm. But we need to be transferring some funds over from payroll taxes to support the program. And I also support making it easier for folks to move flexibly in and out of it. Right now, folks qualify and are often afraid that if their condition improves, if they reveal that, they might be denied in the future. So we should change that and recognize that people should have the flexibility to move in and out of the program as their conditions change or unfortunately worsen. Very quickly, I do support additional funding to support the Social Security Administration. And I think constituent services is another area where we deserve better here in our district. Tom McClintock is notorious for not being the advocate that we all need. So we need to have better staffing at the federal, at the level of the SSA, but we also need better service from McClintock. I support eliminating the windfall elimination provision. I agree that if you paid into Social Security, you should get back the benefits that you're owed. And in terms of Medicare, I agree that we need to be doing more for healthcare in our country. I support the addition of a public option to our functioning healthcare marketplaces right now. I think that Medicare Advantage could be a great model for such a public option to allow people to buy into it, ensuring that everybody has access to at least one high-quality insurance program. I do support efforts to expand Medicare coverage, not just to dentistry and podiatry and vision as listed here, but we also need to do more for pain management. I've talked to some ER doctors who are prescribing, and even primary care doctors who are prescribing opioids because they're covered. And things like extended courses of physical therapy, massage, acupuncture, all sorts of other pain relief measures are not covered and should be.
Amen.
I'll also point out that Tom McClintock's votes in the last year would have thrown you all back into the donut hole while we're talking about healthcare prices. Sometimes people don't connect the dots there, but eliminating the donut hole is a very important part of the Affordable Care Act and something that I'll fight to continue its progression towards elimination. Finally, whew, that was a lot. I think we're nearing the end. What are some top priorities? First of all, retirement security and consumer protection. McClintock has also voted to repeal the fiduciary rule that requires retirement investment advisors to act in the best interest of their clients. I'm opposed to that. Affordable housing is under threat nationwide and for our seniors in particular. And finally, veterans issues I'll mention. We have a very high percentage of veterans here in our district. It's about 10% of our population, and the VA is under threat of privatization, which I oppose. Thank you so much. I wanted to conclude just by noting that part of the way we fund these measures is, if it's okay, if I can just ask, some folks went through the questions in their extra minute. I just want to tell you a personal story really quickly in my extra minute. Is that okay? Yeah. Hope so. All right, we're going to do it. Because it's important. So I actually wanted to conclude by telling you that I was here at the groundbreaking of this community center. And some people will say, how are we going to pay for all these things, right? How do we actually fund everything I've listed out here? One thing that's really important is investing in future generations, in job training, reducing income inequality, because when we have wage growth and we have more wages paying into the system, that's an important part of paying for all these benefits. And our community made those investments in me. That's why I want to defend them and ensure that we can make them for future generations. Thank you.